only is diabetes a disease all on its own, but it also has the potential to cause many complications, including but not limited to skin conditions, sleep apnea, neuropathy, kidney disease, complications with the heart, blood vessel damage, heart attack, stroke, and eye disease. But today, we would really like to focus on diabetic retinopathy and neuropathy, which are both complications of diabetes. Most of the time, there are no symptoms during the early stages of retinopathy, and many people may not even be aware that they have it. Later, people with this disease may experience spots on their eyes, blurred vision, floaters that may or may not go away. The best treatment for diabetic retinopathy is early detection. Although diabetic retinopathy may not always be reversible, early detection can lead to its reversibility. Early detection also helps reduce the risk of blindness, but cannot reverse lost vision that was previously caused by the retinopathy. Diabetics should go get an eye exam at least once a year. This disease is caused when high blood sugar causes destruction to the blood vessels in the eye, and particularly in the retina. The eye tries to compensate for the destruction and rebuild the blood vessels, but there's a decrease in vision. The high blood sugar also causes leakage from the blood vessels and interrupts vision. Without treatment and detection, this disease can cause permanent or reversible blindness. Many treatments for diabetic retinopathy are lifestyle changes. Ways to prevent this disease include controlling blood sugars and seeking medical help if unable to control blood sugars. So as a diabetic, if you're continually having high blood sugars, you should definitely go see your endocrinologist and see what other plan they can have for you and your insulin. Another way you can prevent this disease is by having yearly exams for your eyes. And this exam should include the eye dilation, because the eye dilation is when the doctor puts the drops in your eyes, and that makes it so that he can see the backs of your eyes. He might also use some things like the Snellen chart, which this is a Snellen chart. It just kind of gives a baseline for how your vision is, and it basically shows what a normal person can see at 20 feet and what you're seeing at 20 feet. So they need to keep a log of how your vision has either gotten worse or stayed the same. And they'll probably make you cover one eye and stand back 20 feet and read off the letters. And this just kind of provides a baseline for your ophthalmologist. Another thing they may do is tonometry, and that's when they put the puff of air in your eye, which is also uncomfortable, but very useful so your doctor can see if there's anything else going on with the pressure in your eyes, in addition to any issues that you might be having with your retina. Other ways you can prevent retinopathy is by maintaining healthy cholesterol levels. Making sure that those vessels aren't getting clogged with cholesterol is very helpful. No smoking, because that also plays a role in what your blood vessels are doing dilation-wise. And exercise helps keep your vessels healthy. Once a person is diagnosed and the condition worsens, they may need to have surgery. Steroids can also be used. That just helps control the inflammation in the eyes, or a change in their insulin regimen can also help. Some available treatments include lasers, injections of medications, virectomy, which is a surgical procedure that just removes some of the scar tissue. But the best treatment still remains the early detection. So remember those yearly eye exams.
In diabetic patients, their blood sugar is increased, which damages the small blood vessels in the eye, affecting the structure and the function. The vessels may thicken, leak, develop clots, close off, or grow balloon-like bone-like defects called microaneurysms. Once a patient has been diagnosed with diabetes, they need an eye exam to establish a baseline for comparison. After that, the patient will need to get an annual eye exam with an eye specialist called an ophthalmologist. This will help with early detection of diabetic retinopathy. So, what should a patient expect at an ophthalmologist appointment? The doctor will want both a complete health and vision history. The patient may be asked to do a vision acuity assessment by reading a Snellen chart. The doctor will examine the retina with a special tool called an ophthalmoscope. The pupils will be dilated to get a better look inside the eyes. The doctor will view the retina with lenses and a special light called a slit lamp. The ophthalmologist may also do a procedure called a fluorescent angiography, which can show changes in structure and function of retinal blood vessels. Fluorescent, a yellow dye, is injected into the veins and pictures of the retina are taken to show blood vessels. The diabetic eye exam will also include testing for glaucoma and cataracts because they occur more commonly in diabetic patients. To treat diabetic retinopathy, prevention is key, which can be accomplished with good control of blood sugar. A laser or surgical procedure called a vitrectomy may also be done to preserve vision and prevent further vascular changes. Some doctors may recommend this before problems even develop.
I'm going to talk to you about neuropathy. Neuropathy is nerve damage that can occur in people with diabetes. It usually takes several years to appear. Symptoms of neuropathy are pain, numbness in your extremities, along with problems with the functioning of your internal organs. Diabetic neuropathy is caused by high levels of fat or sugars in the blood that leads to damage to nerves in your body. There are 4 different types of neuropathy. The first type is peripheral neuropathy. This type of nerve damage usually affects the feet, legs, arms, and hands. According to the NIDDK, about 1/3 to 1/2 of people develop peripheral neuropathy. Manifestations first start in the toes, then move upward. It is important to make sure to check your feet regularly of injury and wounds. Second, we have autonomic neuropathy. Autonomic neuropathy is damage to nerves that control internal organs and can lead to problems with your heart rate, blood pressure, digestion, bladder, sweat glands, and eyes. Next, we have focal neuropathies, which you have damage to a single nerve, most often in your hands, torso, or legs. A good example of this is entrapment syndrome like carpal tunnel. Then we have proximal neuropathy, which is a rare and disabling nerve damage in your hip, buttock, or thigh, and usually only affects one side of your body. To diagnose neuropathy, your doctor will review your medical history and do a neurological exam. He might check your tendon reflexes, muscle strength and tone, and your ability to feel certain sensations. To help lead to your diagnosis, your doctor might order tests like a CT, MRI, EMG, or other nerve function tests that screens how you feel touch, vibration, cooling, and heat. There are no cures for neuropathy, but medications like Neurontin, Lyrica, and Tegretol can reduce nerve pain, and you can reduce progression by managing your blood sugar.
So after this video, the main thing that we want you to remember is to manage blood sugar, check on your feet regularly, make sure there's no sores, and also go to your eye exams. These 3 things will help you stay healthy as a diabetic. Thanks for listening to our video.